Occupational English Test. Listening Test. This test has 3 parts. In each part, you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information that you hear. Now, look at the notes for Extract 1. Extract 1, questions 1 to 12. For questions 1 to 12, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes. What brings you here today?
Well, I had a reverse total shoulder arthroplasty surgery on my right shoulder 6 weeks ago, and I have a sling for the past 4 weeks. I've just been doing what the home health people tell me. I just can't lift anything. I have no shoulder hyperextension, and I just need to rehabilitate from that surgery.
So you said that you can't lift things. Right now, how about, what things does your shoulder keep you from doing that you'd like to do?
Well, pretty much anything is difficult. I can't hold anything that's heavier than a coffee cup, and I can't support my own body weight. I can't drive, and I can't really do many outdoor things like go fishing with my grandson and stuff. I also like to play catch with him. But I'm right-handed, and my shoulder hasn't allowed me to do that. Since I had my surgery, to be honest, I was having a tough time doing that beforehand.
Are there any other issues you face due to your shoulder, such as opening doors or while navigating through your house?
Well, as long as I can do it with my left shoulder, that's fine. But while doing anything, I just have kept my right shoulder here in the sling for most of the time, so I can't really do anything with that. Like putting on a shirt and brushing my teeth left-handed are hard. It's kind of weird as you don't do it often.
Yeah, I understand. That's hard. Well, I know you've had the surgery. Have you had anything else in your past, like a medical history?
15 years ago, I had a rotator cuff repair. I have played a lot of tennis in high school and in college, and I think doing all of that really put a lot of stress on my shoulder. So I had surgery on that, and then the past year I have had increased pain, weakness, and loss of range of motion in the shoulder here.
Now I want to know more about your past. Do you drink?
I have a beer every once in a while.
Okay. How many times a week do you drink?
I just have a couple on Saturdays.
Okay. Do you smoke cigarettes?
I don't. I used to, but not anymore.
Okay. I'd also like to go through some other details just to make sure everything else is fine. Have you had any history or currently any problems with your heart?
I do have hypertension, but I take medication, and that seems to take care of it.
What medications are you taking right now?
I'm taking 2 medications with some goofy names, NSAIDs and Sotalol.
Okay, those are anti-inflammatory. How often do you take them?
Well, I'm supposed to take NSAIDs once a day for pain and Sotalol, I think twice a day.
Do you live with your family?
Yes, with my wife, Gretchen.
What is your occupation?
I was a school teacher for 28 years, so now I mostly do stuff for leisure.
Okay. How much did you exercise before the surgery?
I tried to get out, and we have a little dachshund, so I would get out and walk him every morning. I'd take him down to the high school. That's down from the house, and we do about a half mile on the track every day. It helps to kind of keep me limber.
Yeah, that's pretty good exercise. Now that you are moving a little bit, what do you think the pain is at right now on a scale from 0 being no pain, 10 being the worst possible pain imaginable?
It kind of fluctuates, but I would say most of the time it's right around 4.
Okay, and does it ever get worse?
In the mornings, it's a little stiff, and that's probably the most painful. Sometimes if I roll over in my sleep, and that doesn't feel very good.
Extract 2, questions 13 to 24. For questions 13 to 24, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
Good afternoon, Mr. Butler, is it?
Yes, Terry Butler.
So, your GP has referred you because of a problem you've been having with your nose. Can you tell me more about it, please?
Well, it's usually when I first wake up, I get a terrible crusty mucus, but it tends to stay around for the whole day. It's been irritating me for a couple of months. Actually, I initially thought it would just resolve by itself, but it hasn't. The thing is, and I know it's a bit disgusting, but sometimes when I try to get it out, I've had a little bit of bleeding. It's not a lot by any means, but enough to notice. I've also noticed, for example, when my wife puts on perfume, it's my sense of smell. I can't seem to detect it as strongly these days, so I'm a little concerned over that. I mean, I can still breathe, of course, but it's worrying. I actually thought I was allergic to something because we recently adopted 2 cats. Maybe it was, I don't know, dust mites or the season, because I suddenly started sneeze. Not all day, but still quite often regular sneezing. But that's not the case apparently. I know this condition isn't dire, but it does affect my life. The blocked up feeling can really hurt sometimes.
I'm sorry to hear it's caused you so much.
Well, I'm also concerned about my job. I'm a hire car driver, and it's mostly for high-end clients, so it involves a certain degree of professionalism. The last thing I need is to be seen constantly playing with or twitching my nose, or worse still, sneeze and cause an accident.
So you don't believe it's allergies?
Well, not as far as I know. I've been to my GP, as you know, and tried to rule things out first. I had a skin prick test, and that didn't show anything, so I went away thinking it would clear up. But then, after a few weeks, it was still annoying me, so I had a blood test, but that apparently came back clear. But I keep thinking maybe it's something less common. And that's why nothing's shown up. My GP asked if I'd been ill because he thought perhaps it was caused by a viral infection, but I hadn't been. He also asked if I was taking any medications that he wasn't aware of, like beta blockers or antidepressants, which I wasn't. In fact, the only thing I'd started using around that time was a nasal decongestant spray that I bought from the chemists, which he then advised me to stop. He thought maybe I'd been using it too much, so I did, of course. But doing so didn't seem to make a difference.
I see.
And he suggested I try a few to see if they make a difference. So I got a humidifier that apparently helps with the dry air and therefore to loosen the mucus, which was okay, but it didn't make too great of an impact. He told me how to make up a saltwater solution. It's much cheaper than buying it from the chemist. I still use it now, and that helps a little too, but just not for long periods of time. So I have to keep it up a few times throughout the day before going to bed. He said I should take an antihistamine, but again, it just doesn't seem to last too long. And before I know it, I'm feeling the same as before taking it.
And how's your health generally?
I'm typically as fit as a fiddle. I quit smoking 14 years ago because of a number of recurring lung infections at the time. There were enough to make me wake up to myself and finally go cold turkey. That's for alcohol. Well, I've been having my regular night cup of whiskey for 20 years, always the same brand, and I always stop at 2. As I said, I'm reasonably fit for my age. I go to the gym regularly. I've been involved in a cycling club for a number of years, or a medium distance group, and average around 60 kilometers an outing, so not too shabby. So do you think there could be something wrong with my nose?
Well, that's what we intend to find. The way we do that is by performing a
That is the end of Part A. Now look at Part B. Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25.
Hello, and good morning, everyone. I want to start off today's briefing with a reminder about confidentiality. Confidentiality may seem a very straightforward principle, but translating principle into practice can be problematic, particularly in emergency situations. We often find ourselves in all sorts of situations where it may be difficult to know if patient information is to be shared or not, such as with social workers. This is the particular issue that I want to address today. We must keep in mind that social workers have no more right of access to confidential information than anybody else, except in a limited number of situations, such as when the patient has given consent to the release of information, a court order is present, or when the public interest in disclosing information outweighs the public interest in preserving patient confidentiality. But for this last condition, we must look to what the law says. The Data Protection Act lists a number of exceptions that would allow for patient records to be disclosed.
Now look at question 26.
Do you ever feel that a lot of what we do is just talk to people?
I suppose so, though I wouldn't put it that way. Just talk to people. The way we communicate with patients is an important part of our jobs, especially since doctors often don't have the time to do so.
I'd never really thought of it that way. I guess I think about my job as providing health care to people. But as a nurse, making patients feel comfortable with care is also important.
Think about the times when communication with a patient has gone poorly. It has a negative effect in many ways. It affects patient compliance, stress levels of both the patient and us, the nurses.
It reminds me of when I used to make home visits. So many of my patients just wanted to have a moment to talk with someone about their day and also their health concerns.
Now look at question 27.
So, Dr. Charles, I had an idea I wanted to run by you.
Yes, nurse, what's on your mind?
Well, as our patient load has been increasing, I've been thinking of ways to make appointments more effective for all of us, but most importantly for the patients.
Lately, I too have been thinking about the same thing myself, but I just haven't had a lot of time to do much investigating.
Well, I came across a list of tips for patients to use to make the most of their consultation. I was thinking we could include this list, perhaps along with a short video in an email that we could send out to patients with their appointment confirmation.
Interesting idea. I mean, it definitely can't hurt, and it probably won't take a lot of time on our end. Can you tell me about some of the tips?
Well, the first is quite simple. Write down a list of questions and concerns before your appointment. And the next is be prepared to take notes about what the doctor says.
Now look at question 28.
Welcome, ladies and gentlemen. Thank you very much for taking the time to learn about the NIH's transgender effort, the Helping to End Addiction Long-Term Initiative, or HEAL initiative, to stem the national opioid public health crisis. Nearly every institute and center that forms part of the NIH is working to accelerate research to address this public health emergency. The initiative is funding and bringing together hundreds of projects nationwide to help researchers to take a variety of approaches to tackle the opioid epidemic. The HEAL initiative's research priorities seek to address unmet need areas of scientific opportunity and strategies to create solutions to the opioid crisis. One example of a funded program is focused on optimizing collaborative care for people with opioid use disorder and mental health conditions. I'm going to talk about this program in detail for the next few minutes in order to give you a better idea of the type of research we're looking to add to.
Now look at question 29.
So, Dr. Stewart, I'm going to explain a bit about how we do handovers here at the hospital.
Thanks, Dr. Jones. I have heard that the hospital has a very good system here, particularly the pediatric unit. So I've been wanting to learn about how it works.
So every morning we have a multidisciplinary handover at 9 a.m. It's led by the senior nurse on duty and the consultant of the week. This handover takes place in a specific room, and all of the outgoing night team and the incoming day team attend.
Okay, so that's the morning handover. What time does the afternoon handover take place?
And that happens at 4:45, and then there is an evening handover at 9:30.
Now look at question 30.
Dr. Alex, would it be okay if I explain what I'm seeing in this chest x-ray to see if I'm on the right track?
So what do we have here?
So I'm seeing what I think is a lung mass here. You see it is in the anterior part of the first rib near where the bone meets the calcified cartilaginous part.
Oh yes, I see it. Well, some patients have an extra joint near that can simulate a lung mass.
So it isn't a lung mass?
Likely not, but you might consider getting another angle to see.
That is the end of part B. Now look at part C. Part C. In this part of the test, you'll hear two different extracts. In each extract, you'll hear health professionals talking about aspects of their work. For questions 31 to 42, choose the answer A, B, or C, which fits best according to what you hear. Complete your answers as you listen. Now look at extract 1.
Hello, my name's Preston Turner, and I'm a physical therapist specialized in sports-related injuries, assisting athletes from diagnosis through rehabilitation. Today, I'd like to share some details about my line of work, focusing on one of my patients, recently sidelined due to an ACL injury. We'll refer to him as Mike, to highlight the areas I typically work on. To start off, a bit of context. My job encompasses several dimensions of patient care. But what's the key focus? Primarily, ACL injuries, one of the most prevalent knee injuries among athletes, with more than 200,000 cases occurring annually in the US alone. It's a concern that these injuries can cause long-term issues, leading to conditions like osteoarthritis. The lack of awareness about injury prevention techniques and symptoms, such as knee instability, swelling, and pain, is a significant problem. Therefore, spreading awareness about the right warm-up exercises, playing techniques, and early symptom recognition is essential for professionals like myself. Moving on to Mike's story. Mike was a professional soccer player in the prime of his career. He was vigorous and passionate, with a spotless health record. During a match, he took an awkward fall and felt a sharp pain in his knee. However, he dismissed it, believing it to be a minor sprain, and continued playing, which unfortunately aggravated the injury. The next day, due to the swelling and pain, he sought medical help and was referred to a specialized sports clinic. At the clinic, an MRI scan revealed a torn ACL. Mike then consulted with an orthopedic surgeon and was scheduled for surgery. Following the successful surgery, the rehabilitation process commenced, and that's when I met him. Mike was understandably anxious about his recovery and the potential impact on his career. The waiting period and uncertainty about getting back to his previous performance level were agonizing. Athletes like Mike exhibit varied responses to their injuries and recovery process. Some push themselves too hard in rehab, causing re-injury or delaying recovery. Others might slacken the pace, feeling relatively better, leading to incomplete recovery. Common concerns include the fear of re-injury, coping with pain during recovery, and the psychological effects of being sidelined. As therapists, we need to handle these reactions, providing appropriate encouragement and guidance. To address these challenges, we've initiated follow-up clinics for sports injury patients in our community. We see patients at various stages of recovery and, if required, refer them back to specialists if they show concerning symptoms. The continuous contact with the patients helps us build a rapport, making it easier to provide personalized advice and answer their queries. Although still under study, we believe these clinics play a pivotal role in athletes' recovery and hope to see more such facilities in the future.
Now look at Extract 2. Extract 2, questions 37 to 42. You now have 90 seconds to read questions 37 to 42.
Good afternoon, everyone. I'm Dr. Jane Carter, a cardiologist with a deep interest in the overconsumption of energy drinks, especially among our youth, a phenomenon experts have begun to call the invisible health crisis. Now, we're all familiar with the images of smokers, alcoholics, or drug addicts, but addiction to energy drinks is much less recognizable. One reason is that the people affected cut across all demographics. There's no typical age, social class, and so forth. And of course, these beverages are often consumed freely without a doctor's prescription or even parental consent. This underscores a significant aspect of the problem. There's a lack of awareness and regulation on the potential risks of these drinks. In the recent decade, there has been a dramatic increase in the consumption of energy drinks. I observe a pattern not just of individuals overconsuming, but consuming inappropriately. Yes, people want a quick energy boost. That's understandable. But proper energy management requires good nutrition and sleep, which our fast-paced society often overlooks. Therefore, these quick, easy alternatives have become the norm. Furthermore, while energy drinks can provide a short-term boost, they shouldn't be the automatic go-to option. Many healthier alternatives exist, and they're no more expensive. People generally think of fatigue as a direct symptom of physical or mental exertion. But fatigue is an extremely complex subject and one that was overlooked in health education. Now, physicians understand when a patient complains of chronic fatigue, it may not be due to overworking alone, but could present in people with other underlying health problems. These need investigation. For example, we first need to know if the fatigue is caused by inadequate sleep, poor diet, or stress. Establishing this makes misdiagnosis less likely, meaning treatment is more effective and risks of long-term health problems are reduced. But it's not just energy drinks we need to monitor. People often self-treat fatigue with readily available caffeine products like coffee, tea, and soda. These products play a significant role in our society, but there's a need for better education about them. There's increasing awareness about caffeine dependence, and many physicians are warning their patients about the risk of consuming higher and higher doses for energy. However, I've seen cases where people inadvertently consume caffeine products, which could potentially harm their health, particularly if they're on certain medications. This issue needs urgent attention. Now, I'd like to share the story of a patient referred to me, a 16-year-old boy, let's call him Jake, who was consuming multiple cans of energy drinks daily. Like many teenagers, Jake was using these beverages to stay awake for studying and socializing, but he didn't realize the potential harm. The drinks increased his heart rate, caused sleep disturbances, and made him feel jittery and anxious. Living with these effects impacted his social life, his school performance, and his overall well-being. He was eventually diagnosed with caffeine-induced anxiety disorder. Thankfully, Jake is now much better. He recognized his dependence, and with the right support and interventions, he's now living a healthier lifestyle. The critical thing is to prevent dependence from forming in the first place. Jake's parents were unaware of his excessive consumption and hadn't realized the possible risks. Jake admitted to buying these drinks from convenience stores and vending machines at school. Now, Jake realizes that energy drinks weren't the solution to his problem. With the right diet, sleep, and stress management techniques, he's been able to regain control over his health. It's our duty as healthcare professionals and educators to spread awareness and help prevent these cases from occurring in the future.